Welcome to this episode of Gender Equality Talks, or GE Talks as we call them, in the lead up to the International Conference on Family Planning taking place this month in Thailand. We are indeed privileged to have a very special guest today, Professor Aziz-un-Nisa Abbasi, Dean and Professor of Obstetrics and Gynaecology Department of Ayub Medical College of Abbottabad. She is also the National President of Society of Obstetricians and Gynaecologists of Pakistan and Abbottabad Chapter President of Society of Obstetricians and Gynaecologists. Welcome, Professor. You wear so many hats, and it is indeed an honor to have you here with us today. Can you tell us what is the uptake of family planning in Pakistan? What are the successes and challenges you are facing?
Thank you very much for inviting me indeed in a very important meeting. I feel honored to join you on this forum. I would like to share a few words about my organization, Society of Obstetricians and Gynaecologists of Pakistan. It is the biggest body of obstetricians and gynecologists here in our country, and we have around 4,000, more than 4,000 live members, and we have 28 different chapters, sub-chapters all over Pakistan. And all the activities we perform through these chapters and sub-chapters. About family planning, you're asking about family planning in Pakistan? Yes, update on family planning?
Yes.
Family planning conception is not very clear here in Pakistan in our population, and prevalence for family planning in cities is up to 35%, and in rural areas very low, just 5 to 10%. And people mostly prefer to have natural family planning methods like breastfeeding and condom and they are always reluctant to go for pills and IUCDs and all that. But nowadays we are arranging regular activities and workshops for this postpartum family planning and postpartum post-abortion family planning, and mostly we advocate for this PPIUCD because it's the high time to catch the patient, because once they go home, they usually don't come back after 6 weeks. So we are advocating to go for PPIUCDs, and implants and LARC methods are prevalent here. Implants and injectable contraceptives for OCPs, because most of the ladies they are not educated enough to take OCPs daily. So mostly we are advocating for this LARC procedures, and secondly sterilization after cesareans if there are repeated cesarean section. So after 2, 3, 4 cesareans, if the family is complete, so we are going for sterilization.
Okay, so you have big work ahead of you and your organization as well to work in this direction. What about the problem of unintended pregnancies? It is a big issue in many South Asian and Southeast Asian countries. What is the status in your country and how are you tackling it?
Most of the pregnancies in our country are unplanned, 80-90%. But unintended pregnancies, as a Muslim country, so termination of pregnancy is not advisable really on the religious grounds. But it is advisable if there is any medical problem in the mother, there is abnormalities in the baby. So termination is advisable on medical grounds only, but not on the social and other issues because of this religious concerns.
Okay. So So abortion rates would be less or more, or in the hospitals, or are they?
Abortion rate
Anything?
10 to 15% spontaneous abortion rate.
Okay.
But
Okay.
termination rate is quite low. Termination, deliberate termination is low. But patient, there is misuse of misoprostol nowadays, and patient do get misoprostol to terminate pregnancy. As it is available on the counter and without prescription, a patient can have it. Unfortunately, in my country, they can have misoprostol. Most of the time, they come back to us with the complications, bleeding and all that. But people do try to terminate pregnancy, medical termination, and also the backdoor in the midwives and LHVs and nurses and some doctors. They also go for termination, but it's not legal in our country to terminate pregnancy.
What about HIV infections and other sexually transmitted infections in women? Is that a challenge in your country?
HIV infection is not very common. Maybe we are not doing screening too much, screening for HIV in every woman. And hepatitis B and C screening we do in pregnancy. And previously, 10 years ago, the prevalence of hepatitis B and C in pregnant women was 10%. I personally did a study in my area. So it was 10%. But because of the repeated awareness and precautions and hepatitis B vaccine, incidence of the hepatitis B and C has come down, where it's less than 1% now. HIV screening is not widely performed. And as far as STI is concerned, many people, many patient, every third patient presenting in a gynecological OPD, they do have vaginal discharge. And again, it's very difficult to do testing for chlamydia and gonococcal infections and all that because of the resources constraints. So we treat them with that is WHO syndromic management. So we do give medicines for that, syndromic management for STIs, and also give the same medicines which are proposed to the partner and husband as well to prevent it. But STI, I think it is there, but HIV prevalence is not very high in my country, I think.
Okay. Maybe because of less testing or not recorded, as you said. Yes. So when we are talking of yes, sorry. Yes. Yes, please continue. Sorry for interrupting.
Maybe because of this adherence to the religious rules and the no multiple partners and like that, so it could be like that, or it could be due to under testing as well.
Okay. So coming to STIs and other illnesses, is antimicrobial resistance a challenge with respect to obstetrics and gynecological procedures? What I mean by antimicrobial resistance is that are there any bacterial, viral, or fungal or parasitic infections you all have come across related to your field, that these infections, are they becoming resistant to the existing drugs or are becoming more difficult to treat?
Actually, resistance, antimicrobial resistance is there. Yes, of course. We do have repeated infections after surgery, major surgery, because as you know, in my country, we don't have any regulations for prescription drugs and all that. They can have antibiotics on the counter, and there is a lot of misuse of antibiotics. Recently, WHO has urged our country people not to take drugs without prescription from qualified doctors. So we do have, sometimes we have wound infection, which is very difficult to treat with repeated antibiotics, and probably that is due to antimicrobial resistance. Misuse of antibiotics is very high in the country.
Okay. And maybe also antivirals and antifungals also, perhaps. What are your insights on how to curb antimicrobial resistance? It is becoming a global health emergency now. So what would you suggest that this is stopped or reduced?
Actually, I think that in underdeveloped countries, we should have regulation on uncounted drugs and all that. Everybody should not be able to just go and buy antibiotics and have it. And they should have proper diagnosis, proper cultures, and proper antibiotics should be administered for a good time. Because even they don't take it for full time, and then repeated doses and repeated alternate drugs, they lead to resistance. Secondly, over the counter, and there should be public awareness that they should not be taking antibiotics for everything, just for flu and mild ailments. They should not take antibiotics.
Right. What about genital TB? Are there cases of genital TB, and is it a challenge in the context of obstetrics and gynecology?
Yes, genital TB usually is diagnosed pelvic tuberculosis during investigations of infertility. Recently, I have seen a patient on laparoscopy. She had all the features of genital tuberculosis, and genital tuberculosis is secondary to pulmonary tuberculosis. And there is a comeback of pulmonary tuberculosis because of the multiple drug resistance. Genital tuberculosis is there. And usually investigations of infertility, we come to know that this is tuberculosis.
And pulmonary tuberculosis, is it high in women? Or
yes, it is, but not very common. But pulmonary tuberculosis is there. Yes.
Also, what about the non-communicable diseases? Are they posing a challenge in the treatment of or in the context of obstetrics and gynecology? Non-communicable, yes.
Non-communicable, like any particular?
No, any diabetes, heart disease, or hypertension. Are they a constraint in discharging your duties as a gynecologist?
Like, of course, we have diabetes, hypertension. Every third patient of gynecological problem is either diabetic or hypertensive. There is pandemic of diabetes in my country, and I think it is quite common in all the Asian countries. We frequently have many patients with diabetes in pregnancy, and they end up with complications if not properly looked after. Same is with the hypertension and superimposed preeclampsia and eclampsia. Cardiac problems like valvular heart disease and rheumatic heart is still common, and it is usually, sometimes it is usually diagnosed during pregnancy. Mitral stenosis and all that. So medical disorders in pregnancy and gynae patients we do have is quite common.
Can you please share your message for ICFP 2022?
Wish you a very successful family planning programs, and do share your this knowledge of new knowledge of family planning methods related to, and do share this talk with me as well. Thank you very much.
Yes, definitely. Thank you very much. And with this, we come to the close of today's conversation with Professor Aziz-un-Nisa Abbasi, National President of Society of Obstetricians and Gynaecologists of Pakistan, and Abbottabad Chapter President of Society of Obstetricians and Gynaecologists. My sincere thanks to you, Aziz-un-Nissa ji, for sharing your valuable insights on the status of sexual and reproductive health in Pakistan and the way forward. All of us must join hands to create a socially just and ecologically sustainable world order for everyone. And according to me, and I'm sure you would agree to this order can only be a feminist world order. So thank you very much. Namaskar.
Thank you very much.
Thank
Nice
you.
talking.
Yes, nice talking to you too. Thank you.
Thank you very much.